So, well, I have to say I'm rarely at a loss for words, but today has just filled me up in such a way that I need to think about everything that we learned and be able to reflect on it and think back. And so I am fortunate and I'm thrilled to be joined by my friend and colleague, Dr. Phillip Alberti, who's the founder of the American Association of Medical Colleges Center for Health Justice. And I'm hoping that Phillip has a few more words than I do, but our goal in this last session of our innovation summit is to really summarize and some of what we've learned today. Really look at some of the themes, look at words, look at definitions, and then talk about a call to action. And I think that this is when we planned the summit, it was clearly before the election, and now as we're looking at the next 4 years, I think we have to situate our call to action within where we are today, our current socio-political environment. And I think Ifemo Udo said it very clearly when she talked about looking at local and regional and state activities, not simply federal activities. So, Phillip, thank you so much for joining me. And I just wanted to ask you to pull out some of the themes. I think there were so many themes that were in every single conversation, as well as relate them to remind us a little bit of the definitions of health justice and health equity, and how these themes are connected and how they're aligned with health justice and health equity.
First, thank you, Gwen, for this incredible day. I was taking notes furiously the whole time, and I wrote down, food for my soul. I think at this time, this community, these conversations are so important. So I'm just really honored and humbled to be a part of it. I did write down a whole bunch of words and themes that resonated with me. So here they are: trust, solidarity, community, listening, language, narrative, story. And then I wrote down one word that resonated in a negative way because it was true, and it was one of the first ones that you said, and that was subordination, and how so much of the injustice is related to these false hierarchies of human value and subordination. That was a hard word to hear. It really jarred me, but it's important to lift that up too. I'll happily talk about definitions. So I'm an epidemiologist by training, and so I love definitions and precision. And so I won't give you the whole spiel. Maybe we'll have another conversation about the whole spiel. But we at the Center for Health Justice at the AAMC talk about health equity being our goal and health justice being the path that gets us there. So at the very least, I'll just unpack those two kind of seemingly simple sentences. We start with that lodestar definition that I know that you know and everyone on the call knows from the CDC about health equity. I like to keep the end in mind, right? That's our goal. In CDC, health equity is a state when every community has a fair and just opportunity to achieve its highest level of health. And if I had my slides behind me, you would see that I've added boldface to fair and just opportunity. And so one of the themes that we talked about was language. And I think the language of opportunity is key. I think oftentimes we slip and we say things like equal outcomes. I want to counsel all of us that equity must not be about equal outcomes. And I'll give a very specific you also mentioned 4 years. What do we do? In 2021, Dr. Ben Carson wrote an op-ed for the Washington Post where he called all equity work racist and un-American. And the reason that he defined equity work, health equity work, as un-American was because he said that rather than focusing on equal opportunity, that we are trying to mandate and force equal outcomes. And so they take the strength, right, the strength of our goal of making sure that all communities really have an authentic opportunity for health and say, oh, we're not about that. So I urge all of us, call to action. How can we do a better job framing our work around health equity and health justice as the creation of authentic opportunity, not that fake opportunity where a mayor says, oh, I built that supermarket down the street, it's 5 miles away, you have no public transportation, no sidewalks, but it's your fault you didn't access. The previous panelists talk about access. It's your fault you didn't access that supermarket. We mean opportunity by default to all of the things that make communities thrive. Healthcare, yes, but drinkable water and humane housing and a thriving natural world, these very basic fundamental building blocks for health. We also heard a lot about the zero-sum game. So I also want to just stress that we can have it all, right? We can have communities that are characterized by reliable transportation and safe housing and effective healthcare at the same time as we have millionaires and billionaires, right? The zero-sum game is a policy choice, and we can make different choices to more justly distribute that opportunity across communities. So that's kind of that one little piece. But to focus on health justice, and then I'll be quiet because I could talk forever. The way that we talk about the process of achieving health equity, this process of health justice, is to say that we keep one foot grounded in community wisdom and multi-sector partnership, with the other foot in a research or an evidence to policy action imperative, and then walking towards that goal of equity in a very explicitly anti-racist and anti-discriminatory way, which for us in the center means power, right? Who has power to decide what research questions we ask or policies we interrogate? But just going back to those 2 feet and those theme words that I mentioned, right? That first foot is about solidarity, right? It's about community. It's about multi-sector and diverse engagement, understanding that the system for health, and this is maybe a disagreement with Dr. Stanford. I do worry about the medicalization of health and the medicalization of health equity. Healthcare has an unbelievably necessary role to play, certainly in ensuring healthcare equity and that equal opportunity for all patient populations to get the best treatment for them at that time. But also, every other sector has a role to play. And I think that's really important. And that second foot is about law, right? And systems change, right? How do we actually co-create the kinds of evidence that will open up new avenues of opportunity for all communities? And so I think, Gwen, you mentioned at the outset that there's maybe a tension, or you could think about health justice in both a community way and a law way. And I would say that it's actually both, right? Health justice is community connected to law, right? Mm-hmm. Via the generation, the co-development of evidence and story and narrative and data that actually move that needle on opportunity for organizations and at local, state, and federal kind of political levels. So I'll stop. Those are my definitions and trying to highlight some themes. I hope that was
that was great, Philip. And I think I think that it's not that their intention it's not that the definition that, thinking about health justice as either community driven or community empowering or changing the laws or intention. I think that what has come up over and over again today is that there may be a threat going forward in the next number of years to being able to achieve health equity through laws and legislative changes. And I think there's also been a thread throughout all of this to really look at things from a community level, from a local level, from a regional level, a state level, and not simply looking at things as a federation. Yep. I was thinking about. I actually wrote down a bunch of notes and then highlighted all of them. So I'm not sure. So usually you're supposed to only highlight what is the most important, but these were also important. And one of the things that Lily had talked about, and I think this was also a theme and an underlying theme, and implicit and explicit in everything that people said, was that, they didn't see the humanity of our fathers. And so how can and then she reminded us that what they told people in the U.S. public health study of syphilis in the untreated Negro male was that they had bad blood. Mm-hmm. And that I have to say, that just triggered so many different fears it just reminded me of so much of what's happening and where we are and how we might turn back. But how do we continue And I mean, what are some of the ways that we can continue to ensure that we see the humanity in everybody? We talked about it on the last panel. We talked about it in the interactive narratives medicine section. Lily Head talked about it. Ayla Stanford talked about it. But I think at the core of so much of what we're doing as we try to be on the same page so that we can turn the page is really to commit deeply to not only seeing, but lifting up the humanity in everyone.
Well, wow, that's a huge question. I just want to say one thing. No, that's amazing. We'll see where I go with this one. But I think, one a ray of hope that I wanted to point out from the election, and I think this speaks to your point about how do we navigate and the focus on the local or the state or the county. So I looked at what happened in Missouri, right?
Mm-hmm.
So Missouri voted red in every way Missouri could vote red. But then at the state level, they overturned their abortion ban. They raised their minimum wage, right? And they gave themselves guaranteed paid sick leave, right? Those are those basic vital conditions for health and health equity and equal opportunity. And so I think, it might be trite at this point, but there truly is, I think, more that unites us, more that we agree on as a people than divides us. And the divisions are intentional. It is on purpose that we are looking to find enemies in each other and from within. And so I think the way that we move forward and focus on humanity, and I love that. I think it's a two-step process, because right now I think there's not a lot of listening. And I think another theme that came through so clearly was listening. But I think before either side, all the sides, or so many sides, can truly listen, we do have to find that common ground and get on that common page. And so there are certain things that I take heart in from the work of our own center. And I'll just give you two quick data points and we can explore or not explore. So we did a poll just of Generation Z. So just nationally representative 18 to 25-year-olds. And there were unbelievably significant areas of agreement, nonpartisan areas of agreement, where 75% of self-identified conservative members of Generation Z said that healthcare should be a human right and that the American government should provide it. 75% of self-identified conservatives. So you're right. We don't need to focus on
that
the
is
discord.
a yeah.
That is a ray of hope, right? And then the flip side, and we could, or I guess a parallel finding is we tested. There's a lot of conversation now from both sides about reparations, right? The historical way we've thought about reparations, and then this new way that the incoming administration is thinking about reparations. And we tested 7 reparative justice policies from this enormous California report that came out in 2023. And we didn't talk about reparations. We didn't talk about California or race or racial justice. We just tested these policies that would have a racial justice impact, like we should provide more funding for civic engagement education in public high schools, right? 6 other policies, very benign sounding, right? Not leading. And there wasn't a state in the union where those policies tested below 60%. So I think the coupling of finding areas of nonpartisan agreement and then supplementing that with that humane storytelling, with the ability to craft narratives that identify and highlight the common ground, the common goals that all of our communities share, in a way that upends that false narrative of the zero sum, that makes it clear that in solidarity, right, to bring in another theme, in solidarity, these wins can be achieved at the local and the state level, just like wins were achieved for health justice in Missouri just a couple of Tuesdays ago.
Yeah, and that just reinforces things that we talk about among our team, many of whom you met on the screen today, and also with our friends, colleagues, families outside and across the country, is this idea of these things. Healthcare as a right is a nonpartisan issue. And it is, and that it was incredibly heartening to hear the results of your study, because it should not be a nonpartisan issue. And you found that it is a nonpartisan nonpartisan issue. And so as a means of going forward, as a means of thinking about where we're going to find those areas of commonality, I think is a really critical tool and strategy for all of us to take away. And I think there are multiple different tools and ways that we can do that, but it's a really critical strategy.
A precursor, I think a precursor to that work of finding common ground is the work of trustworthiness.
Yes.
Right. And that was another theme that came up in, I think, every single discussion, and for us in the center, it's less about kind of communities made marginalized getting over valid mistrust and distrust, and more about our organizations, healthcare, universities, police departments, schools, et cetera, these organizations with power and privilege in local places and spaces to demonstrate they are worthy of the trust of their community. And I think that's foundational to authentic community engagement, which is foundational to a health justice framework, which is the way that we get to that true, equal, authentic opportunity for all of us.
Right. And that is another theme that has gone through all of our work. And you and I have talked about this for the years that we've known each other, is the notion of trust and trustworthiness, and whether we're starting from the right place or asking the right question. And as most of my friends and colleagues know, one of the things I will always stand up and say is that we're never asking the right question. We're asking the question, we always ask, why does the community not trust the healthcare system? The question is, why does the healthcare system not trust the community?
Mm-hmm. The principle of bidirectionality in all of this work is essential, right? I think part of the hubris, part of what breaks down trust is the notion that these organizations or the folks within them, physicians, scientists, politicians, whomever, don't have anything to learn.
Yeah.
Right. That our expertise, our knowledge is the only one that matters or that counts. And that, again, meeting people where they are more often than not means getting people to come to where I am. And that is not the way that we build bridges and find that common ground for a future of health equity.
And I think it was mentioned a lot in the closing in the panel just before this, was that the idea of learning from people, the idea of answers being in the community, questions being in the community, was a really, really salient theme through everything. We don't learn, there's been a tendency to do research on people, to learn about people, to go into communities and ask questions that come from top down rather than grassroots up. And so I think that was another really potent theme throughout this summit.
Absolutely. And, I think I'll offer one shameless plug. You know me, Gwen, I don't love to talk about the work too much, but we were the first things that our center did was work with 7 diverse communities across the country. This is back in 2020, to develop our Principles of Trustworthiness Toolkit. And so many of the key behaviors in that toolkit, humility, respect, transparency, taking responsibility, authenticity, emerged from these conversations today. And so I encourage, I'll drop a link in the chat if I can figure out how to do 2 things at once, which is unlikely.
Or send it out.
Perfect. But check it out. I think, we're actually evaluating it now. We're working that toolkit with 4 different communities across the country to understand. And I think one of the most important lessons that we've learned, this dance of engagement, whether it's patient engagement or community engagement, is often kind of you have an idea, someone else has an idea, and you do a dance until you develop your own idea together. One of the things that we didn't anticipate was that the mistrust and distrust is often so long-standing and so deep that communities weren't even ready to have a conversation about trust or trustworthiness. There was pre-work that need to happen. There was a different kind of level and depth of bread breaking and common ground kind of fertilization to even begin to have an honest conversation about why, when, how trust was broken or severed. So this work has a long arc, and I think if the election proved anything, we have a long way to go to build that bridge, even given the common grounds around policies that do exist.
And it does have a long arc, and as my friend Mary Jackson Scroggins said, as I quoted her, it's not about taking a different lens; it's about taking our blinders off. And so much of what, pardon me, that was Heather McGee, but I was using that to describe Mary because that's what she really taught me. But what so much of what we learned today was through narratives and through storytelling. And I was really struck by the fact that the panel about achieving health justice together, every panelist started out with a personal story. They didn't, and when, we are, of course, one of the things that we really focus on very much are stories and narratives that really tell a much deeper story and move people to action. And I don't know if you had any thoughts on that before, or observations about that. I don't know if that struck you.
It does strike me, and I'll admit that I think stories are so important. I think personal stories are so important because throughout they cut through the miasma, they cut through the noise, right? They create an instant, like I don't know why this phrase is coming to mind, like a connection of light between people, where you might not know them, you might not think that you have anything in common, but all of a sudden there is this beautiful thread and an understanding. And I will admit, I am Gen X through and through. I am a scientist. It has not been easy for me in my own personal journey to begin telling my stories. But in these last 5 or 6 years, and I really tried to lean into it and get more comfortable, the relationships, the work, everything improves when you can, you mentioned, I think early on, and now we're wrapping up, that word humanity. I think that's the way that you can have that humane connection that then allows your data to be understood, or allows your chart to be interpreted, or at least says, okay, this person, there's something here we can work with. And I think that's why it's so crucial at this moment when it feels to me that we're just surrounded by a lack of humanity and understanding.
And I think, so you and I came into a very similar world because our worlds intersect and very, very much through different means. And I came through as a result of my experience as a cancer survivor. And so from the beginning, storytelling has been central to what, not just what I've been doing, but the idea of the commitment to elevating patients' voices. Not just the patient voices, patients' voices, caregiver voices, community voices has really been central to everything that I've done. And one of the earliest things I learned from advocacy, my first advocacy project was editing a magazine for women with breast and reproductive cancer. And I realized the connections that you were able to make, and that I was able to make, and everybody else was able to make, that transcended different kinds of life experiences that might have kept us apart, whether it was geographic, whether it was profession, anything else. But there were so many different ways of making connection, to the point where I insisted that every single cover of the magazine, that the person who photographed made eye contact. Because I think if we make eye contact, if we really engage, and that's part of engaging in humanity, but we make that eye contact, we make that we are, whether we're in a virtual room or whether we're in a physical room, we kind of breathe the same air together. And so I think that, so for me and for so many of my peers, and the using stories and data, because we have to use evidence and we have to use data, and we also have to use data to tell stories and stories to illustrate data. So it's very much intertwined.
And I think it's also a way. One of the phrases that I scribbled down was lean into the uncomfortable intersectionalities.
Yes.
Right. So I have a bunch of identities. There might be someone from a totally different walk of life, political persuasion. We could find one where we connect. And maybe all the other parts of that intersection are really uncomfortable. Right. But that's the beginning of that bridge and the discord.
Yeah, and it's like one of my favorite things are the Venn diagrams. Actually, my earrings are sort of Venn diagrams today. But it is when there's an area of commonality that is that crosses common values, then there are many things that can be outside of that cross, as long as we come together in common values. And then there's also the common lived experiences, whether it is a deaf person, an Indigenous person, a Black woman, a gay man, a transgender doctor. There's so many ways that we can really elevate that intersectionality. So in the last, we have just about 5 minutes left, not quite, but in that last period of time, I think we heard a fair number of ideas for how we can take action, for how we can for what we can do. And I think if we can just leave the audience with with an action or two or a strategy or two that we can all take together, and we're really return to our theme of achieving health justice together. Is there anything that just comes top of mind to you, or you want to reinforce in what you've said?
I'll reinforce and maybe tie some things together. I think it really comes back to our community, our health justice community, kind of being even more inclusive than we already are, in the way that we talk about equal opportunity, in the way that we try to demonstrate that we are trustworthy partners, even if we don't feel that trustworthiness coming from folks with whom we want to engage. I think the onus is on us to demonstrate our truth, that is health equity, when all communities thrive, benefits all communities, right? And that zero-sum narrative is false. So anything that we can do in our language, our framing, our measurement, our marketing, our communication, to make that point clear that health equity benefits all of us, I think we can weather whatever storms are on the horizon.
Thank you, Philip. That's a perfect conclusion to an incredibly energizing and moving I can't say informative. I just have to say I just learned so much from this day and from everybody who participated. So I look forward to continuing for all of us to work together to achieve health justice, because we really do have to focus on that solidarity and focus on this greater community and the intersectional community that has been mentioned a number of times. So thank you, everyone. Thank you for participating. Thank you for staying with us. And I look forward to continuing our work together.